Have you woken up lately with a persistent cough, a tight feeling in your chest, and that fatigue that just won't go away? What if I told you these symptoms could be your body's warning of something more serious than just a cold? Ignoring the signs can put your health at risk, but recognizing them early can be the first step toward recovery. Chest infections are more common than many people realize. They often arise as complications of poorly cured or poorly treated colds and flu. The problem is that the symptoms are often confused with those of a simple virus, which leads many to ignore the signs and not seek medical help or necessary care. The main symptoms of a chest infection include shortness of breath, persistent cough with yellow or green mucus, extreme fatigue, chest pain when breathing deeply, wheezing, fever, and even chills. These symptoms can vary in intensity depending on the severity of the infection and the overall health of the person's immune system. Another common but often overlooked sign is a change in mucus color. Yellowish or greenish mucus is a strong indicator of infection, unlike the clear mucus typically seen with mild colds. Coughing can also worsen at night or when lying down, making it difficult to sleep and worsening fatigue. Paying attention to these signs is essential, as chest infections can develop into more serious conditions, such as acute bronchitis, pneumonia, or even bacterial lung infections that require urgent treatment. Therefore, if you notice persistent symptoms lasting more than 3 days, especially a constant fever and difficulty breathing, it's important to seek medical advice. Furthermore, people with chronic respiratory conditions, such as asthma or COPD, should take extra care. In these cases, a chest infection can worsen the underlying condition, requiring specialized treatment. The positive point is that, in most cases, chest infections can be treated with simple, natural, and effective measures, as long as they are identified early. The key is to listen to your body. If something is out of the ordinary, if your cough is more intense than usual, or if you feel constantly tired even after resting, it's a warning sign. You'll discover 7 natural and affordable methods that help relieve symptoms, speed recovery, and restore your lung capacity safely and effectively. Don't wait for the condition to worsen. Learn now how to act wisely and prevent complications. Lemon and honey, a classic home remedy. When it comes to natural remedies for chest infections, lemon and honey are a true classic and for good reason. Simple, affordable, and highly effective. This combination has been used for generations to relieve coughs, soothe the throat, and boost the immune system. And best of all, you probably already have these ingredients in your kitchen. Let's understand why this combination is so powerful. Honey is known for its antimicrobial and anti-inflammatory properties. It helps soothe the sore throat and reduces persistent coughing, which is especially helpful during a chest infection. Several scientific studies have shown that honey is as effective as some over-the-counter cough syrups in relieving nighttime cough cess with mild symptoms. Lemon is a natural source of vitamin C, essential for strengthening the immune system. Vitamin C stimulates the production of white blood cells, which are the body's soldiers in fighting infections. Furthermore, lemon has antioxidant properties, helping reduce inflammation and protect lung cells from damage caused by infectious agents. But the real magic happens when these two ingredients come together. By mixing honey with lemon juice and warm water, you create a therapeutic drink that acts directly on symptoms. The warm water helps loosen mucus in the lungs and airways, facilitating its elimination, while the honey soothes and protects, and the lemon boosts the immune response. How to prepare and use. Heat a glass of filtered water, without bringing it to a boil. Add a tablespoon of fresh lemon juice. Mix with a tablespoon of pure, natural honey. Avoid processed honey with added sugar. Stir well, and drink slowly, preferably first thing in the morning. Before eating anything, if desired, you can repeat the dose at night before bed, especially if your cough is more intense during this period. This drink helps relieve chest congestion, soothe a sore throat, and even improve sleep quality by reducing nighttime coughing. Remember that honey should not be given to children under 1 year old, due to the risk of infant botulism. Other than that, it's a safe and effective remedy for most people. Don't underestimate the power of simple remedies. Lemon and honey aren't just a momentary comfort, it's a real way to help your body react faster, with fewer side effects than many synthetic medications, and best of all, it's natural and tasty. Now that you know this classic solution, let's move on to another essential pillar of recovery: hydration. Get ready to discover why water can be as powerful as any medicine. Hydration and steam inhalation. Immediate relief when dealing with a chest infection. We often focus only on the most obvious symptoms, like coughing and fever, and forget a fundamental element. Hydration, keeping the body well hydrated, is one of the simplest and most powerful ways to aid recovery. And when combined with steam inhalation, we create a dual strategy that directly alleviates respiratory symptoms. Let's start with water. Over 70% of the human body is composed of water. During an infection, especially in the respiratory system, the body loses more fluids than normal weather due to fever, increased respiratory rate, or the constant effort to cough and eliminate mucus. When we don't drink enough water, the mucus that forms in the lungs and airways becomes thicker and stickier, making it difficult to eliminate. And the longer the mucus remains, the harder the body has to work to expel it, aggravating coughing and fatigue. The recommendation is simple: drink at least 2 to 3 liters of water a day, preferably in small sips throughout the day, to keep your body continuously hydrated. You can also include natural teas, such as mint, chamomile, or ginger, which, in addition to hydrating, have calming and expectorant properties. Now, let's talk about steam inhalation, a traditional technique that remains extremely effective today. Inhalation helps moisten the airways, reduces nasal and throat irritation, and, most importantly, facilitates the expulsion of accumulated mucus in the chest. You can use a room humidifier, which releases steam into the air throughout the day and night, creating a more pleasant climate for the airways. This is especially helpful in drier regions or during winter, when the air tends to dry out even more. If you don't have a humidifier, another excellent alternative is a hot shower. The steam produced during a shower has a similar effect. You can also perform a simple inhalation at home with a basin of hot, not boiling water, a towel covering your head. Close your eyes and breathe deeply into the steam for 10 to 15 minutes. To enhance the effect, you can add a few drops of eucalyptus or peppermint essential oil, which help clear the airways and reduce congestion. Both hydration and inhalation are non-invasive, low-cost measures that offer almost immediate relief. Furthermore, they complement other natural treatments, which we'll discuss in the following topics. Natural remedies with ginger. Have you ever noticed how certain natural ingredients seem to have been created specifically for healing? Ginger is one of those natural miracles, a powerful root that, for centuries, has been used as a remedy for various health problems, especially those affecting the respiratory system. In the context of a chest infection, ginger stands out as one of the most complete allies. It acts on several fronts. It reduces inflammation, opens the airways, soothes a sore throat, and even strengthens the immune system, speeding recovery. But what makes this root so effective? Ginger contains bioactive compounds such as gingerol, chagall, and zingerone, all with anti-inflammatory, antioxidant, and antibacterial properties. These compounds help fight the microorganisms that cause the infection and reduce oxidative stress, protecting the lungs against the damage caused by chronic inflammation. Furthermore, ginger's strong, refreshing aroma has a decongestant effect, which helps relieve chest pressure and eases breathing. Many people report immediate relief from consuming ginger tea or even inhaling its steam. Here are some effective ways to include ginger in your daily routine during a chest infection. 1. Ginger tea. With honey and lemon. Boil a few slices of fresh ginger in 300 milliliters of water for about 10 minutes. Then, add a tablespoon of honey and the juice of half a lemon. Drink hot, 2 to 3 times a day. This combination is anti-inflammatory, antioxidant, and immunostimulant. 2. Ginger juice. For those who prefer something more concentrated, blend a piece of ginger with a little water and consume small doses throughout the day. It can be mixed with apple or carrot to soften the flavor. 3. Ginger inhalation. Add slices of ginger to hot water for inhalation. The steam helps open the airways, providing relief from congestion. 4. Use ND8. Grate fresh ginger and add it to your meals, broths, soups, salads, or even juices. Besides being a tasty addition, it will also contribute to your recovery. It's important to remember that, although natural, ginger should be used in moderation by people with gastritis or hypertension. If in doubt, it's best to talk to a healthcare professional. Ginger isn't just a spice. It's one of the most complete roots for combating respiratory infections, and can be a true balm when your chest feels heavy, breathing is difficult, and the cough just won't go away. Now that you know about this powerful natural resource, let's move on to another essential component in treating chest infections: essential oils, which can transform your surroundings into a healing space. Essential oils, aromatherapy for the chest. Have you ever felt relief just by breathing in a soft, refreshing aroma? Essential oils are more than just pleasant fragrances. They have the power to transform the air we breathe into a true healing agent, especially when it comes to respiratory problems. During a chest infection, using essential oils can offer profound and immediate benefits. This is because many of these oils have anti-inflammatory, expectorant, decongestant, and antibacterial properties. They help open the airways, reduce mucus, and facilitate breathing. The most recommended oils for this purpose include eucalyptus, one of the most powerful for relieving lung and nasal congestion. It contains cineole, a substance that acts as a bronchodilator and expectorant. Lemongrass has antimicrobial properties and is relaxing, great for the respiratory and nervous systems. Rosemary, a natural anti-inflammatory, helps cleanse the lungs. Sandalwood, calming and anti-inflammatory, it helps soothe coughs. These oils can be used in 3 main ways. Inhalation with a diffuser or vaporizer. Add 6 to 8 drops of the chosen essential oil to a diffuser filled with water. Allow the vapor to spread throughout the room, and breathe deeply for at least 20 minutes. Direct inhalation carefully. Place a drop on a tissue or personal inhaler, and inhale the aroma throughout the day. Topical application with a carrier oil. Mix the essential oil with a base oil, such as coconut or almond oil, and apply to the chest, neck, and back. This creates an effect similar to a vapor rub, but with natural ingredients. You can also make your own homemade rub by combining 2 tablespoons of coconut oil with 6 to 8 drops of eucalyptus or peppermint essential oil. Apply to your chest before bed for a relaxing effect overnight. It's worth remembering that not all oils are suitable for small children, pregnant women, or people with certain allergies. Therefore, always perform a skin sensitivity test before applying large amounts. Incorporating essential oils into your routine during a chest infection can not only alleviate symptoms, but also transform the environment into a more welcoming, moist, and healing space. The air you breathe has the power to heal you, and nature has already given us the tools to do so. Postural drainage, a technique to eliminate mucus. When the chest is full of mucus, breathing becomes an effort, fatigue builds up, and even simple daily activities require more energy. This is where postural drainage can be a game changer in your recovery. This technique is based on a simple but powerful principle, using gravity to your advantage to eliminate mucus from the lungs. By adopting certain body positions, you facilitate the movement and drainage of accumulated phlegm, helping the body eliminate it more easily through coughing or expectoration. How does it work? The lungs have several regions, and in certain infections, mucus can accumulate more in the lower parts. Lying on your back, stomach, or side, with your chest lower than your hips, you create a natural pathway for this mucus to rise to the upper airways, facilitating its elimination. Here's an example of how to do it. Lie on your back on a firm bed. Place 2 or 3 pillows under your legs so that your hips are higher than your chest. Hold this position for 10 to 15 minutes, breathing deeply and coughing gently when you feel the need. Then, repeat the technique on your side and stomach, always adjusting the position to benefit different regions of the lungs. If possible, ask someone to gently tap with your hands in a cupped shape on the back or sides of your chest. This helps loosen mucus stuck to the lung walls. Important, this technique is generally safe, but in more severe cases, or if you have heart disease, high blood pressure, reflux, or are pregnant, it's best to talk to a doctor or respiratory therapist before starting. Postural drainage doesn't require medication, doesn't cause side effects, and can be done at home with discipline and care. It doesn't replace medical treatment, but it's a powerful ally in improving oxygenation, relieving coughing, and speeding healing. Over-the-counter medications and final care. While natural treatments offer effective relief for many chest infection symptoms, in some cases it's necessary to resort to over-the-counter medications. These products are readily available in pharmacies and can be used as a complement when symptoms become more intense, bothersome, or persistent. The most common medications include vapor ointments, such as Vicks, Vaporome, applied to the chest, neck, and back. They help open the airways and reduce coughing. Pain relievers and antipyretics such as paracetamol or ibuprofen, useful for controlling fevers, body aches, and chest discomfort. Nasal decongestants, available in spray, drop, or tablet form. They help eliminate mucus and improve breathing. However, it's essential to follow the correct dosage and instructions on the label. Even though these are over-the-counter medications, they can cause side effects or interactions with other medications. If you have blood pressure, liver, or stomach problems, talk to a pharmacist or doctor before using any medication. Furthermore, it's worth remembering some prevention and self-care measures that make all the difference. Avoid smoking or being in smoky or dusty environments. Wash your hands frequently, especially after coughing, sneezing, or using the bathroom. Keep the environment ventilated and clean, preventing the accumulation of dust mites and mold. Get plenty of sleep and respect your body's limits. Rest is vital for the healing process. Avoid close contact with others, especially indoors, to avoid spreading the infection. Finally, be aware of the warning signs. If a fever lasts more than 3 days, if there is severe chest pain, difficulty breathing, or blood in the mucus, seek medical help immediately. Sometimes, what seems like a simple flu can develop quickly, and early treatment makes all the difference. Now that you know the main natural methods for treating a chest infection, share this content with someone who needs it. Sometimes, a simple gesture can help someone breathe better. Literally, and if you want more tips on natural health, wellness, and lung care, subscribe to our channel and turn on notifications. May your breathing become light, free, and full of life again.